Hello, my name is Phillip Hwang, and I'm a postdoctoral associate in the Department of Anatomy and Neurobiology at Boston University School of Medicine. I'm excited to present today a preliminary analysis of assessing cognitive function using a mobile application among participants with various severity of COVID-19 that was done in collaboration with Johns Hopkins University and Anthrotronics. We hypothesized that those with greater COVID-19 severity would have worse cognitive function over time as compared to those with less COVID-19 severity or no COVID-19. A total of 50 participants grouped by COVID-19 severity levels, such as COVID positive with ICU, COVID positive without ICU, and COVID negative, were included in this analysis. Those with COVID-19 were patients from the Johns Hopkins post-acute COVID team. Participants were asked to complete a task from the Dana app on their smartphone or tablet to measure cognitive ability over a 6-week period. ANOVA was used to examine for differences in cognitive performance between the 3 COVID-19 exposure groups. In our sample, there are 23 participants without COVID-19, 21 participants with COVID-19 but did not require an ICU stay, and 6 participants with COVID-19 and required an ICU stay. We found in our sample that those without COVID-19 were on average older than those with COVID-19, as well as more likely to be female, have higher educational attainment, and report white or Caucasian race ethnicity. Overall, we saw differences in baseline cognitive function among participants with and without COVID-19, as well as trajectories of cognitive function over time between each COVID-19 severity group. However, we did not observe these differences to be statistically significant. Since this was a preliminary study, we acknowledge limitations in the sample size and adjustment for confounding factors. Further analyses with larger samples and collection of additional data will provide more rigorous evidence to determine the impact of COVID-19 and its severity on COVID neurocognitive function. The motivation for conducting this study was due to the growing concerns about cognitive consequences associated with COVID-19 and the limited evidence in the literature, especially studies that included participants with a range of COVID-19 severity levels. Recent studies, though, have begun to examine how the virus that causes COVID-19, SARS-CoV-2, affects the brain. Potential mechanisms include entry through the olfactory nerve and vagus nerve, entry through the blood-brain barrier, and inflammation. Studies of autopsied brains have found that the virus can affect multiple parts and areas of the brain, though the degree of the virus's impact on the brain may be limited. As mentioned earlier, SARS-CoV-2 may disrupt the blood-brain barrier due to microvascular injury, thereby compromising the integrity of the blood-brain barrier and allowing further infection and injury to the brain. In addition to extending what we know about the impact of COVID-19 on neurocognitive function, this project incorporated a novel approach to assessing cognition through the use of mobile-based cognitive assessments, which addresses some of the barriers associated with traditional in-person cognitive testing. Also, COVID-19 has accelerated the adoption of digital technologies due to concerns about having to visit a clinic in person and be in close proximity to others. For this project, we used a mobile application developed by Anthrotronics called Defense Automated Neurobehavioral Assessment, or DANA. DANA has a suite of cognitive assessments that can be administered via mobile devices, such as smartphones and tablets and computers. For this analysis, we focused on cognitive performance based on the procedural reaction time, or PRT task. The PRT task measures reaction time as well as executive functioning and decision-making capabilities. For the PRT task, the participants' screen displays one of 4 numbers, which can be 2, 3, 4, or 5 for 2 seconds. Then the participant taps on the left button, which shows 2 or 3, or the right button, which shows 4 or 5, at the bottom of the screen as quickly as possible to indicate which number was displayed. Overall performance on the PRT task was calculated using a derived measure called the Cognitive Efficiency Score, which takes into account accuracy and speed. The main takeaways from this preliminary analysis are that 1, COVID-19 severity may be associated with worse cognition and longer time to recovery of neurocognitive function. 2, further research is needed to replicate and confirm these findings. And 3, older adults exposed to COVID-19 may require closer monitoring for cognitive impairment and dementia. A recent study found that COVID-19 was associated with a 69% increased risk for a new diagnosis of Alzheimer's disease among older adults. Given the public health challenge associated with Alzheimer's disease, COVID-19 may precipitate an even greater number of new cases of Alzheimer's disease and dementia. This is an area that requires further study and greater attention to, as older adults who are at greatest risk of developing dementia are also likely to have more severe cases of COVID-19. Before ending, I would like to acknowledge the research volunteers who participated in this study and funding support from the National Institute on Aging. Thank you for your attention, and please feel free to contact me if you have any questions.